Well, it was quite a number of years ago when I first started to feel ill at ease, mostly because it was harder to get a breath, a good deep breath, and I would tire more rapidly than I wanted to. And that progressed through probably 10, maybe even 12 years.
I tell you, he kept a lot of it a secret. He didn't tell me a whole lot. I knew he was not going to as many band practices. He dropped one band for a while.
I had to stop going to trombone band rehearsals, not so much because I couldn't play, but because I couldn't get from the car in the parking lot to the front door of the rehearsal hall. Once I got there and got my breath, I could play very well for the hour, 2 hour rehearsal. But then I had to get back to the car again.
He finally came out and said, I think maybe in February, he said, you know, when I get out of the car, I have to stop by the time I get to the front steps. Now, it's not far from the driveway to our front steps. And then he'd come in the door, and if he wanted to go upstairs, it's only 6 steps upstairs. And he says, I have to stop at the top of the steps.
Somebody asked me to play a concert just to sit in because they lost their trombonist. And I picked up my horn, and I couldn't do anything. I could barely make an ugly noise because my lips were shot. Everything was affected to the point where I thought, you know, I would never come around again.
Bob was a sick guy when we first saw him. In fact, he was so sick we weren't sure that we should operate on him. He had had this heart valve problem for so long. It should have been operated on 5 years ago or longer. But he had had it, and then he had developed liver problems. They thought maybe he had cirrhosis. His platelet counts were down.
My cardiologist said, he kept on saying, well, you'll know when it's time. And I said to myself, you know, I think I finally know when it's time. We consulted, and we decided that we would go ahead with this. The actual operation was first scheduled in February, and it finally was done in May.
The surgery itself, they called up once or twice from the operating room to let me know how things were going. And at one point, I think Dr. Saunders got on and spoke to me and told me that I've been trying to repair this for 45 minutes and I can't do it. I want to put the valve in. Do I have your permission? I said, absolutely. We discussed it. We knew this was an option. And seeing the results, definitely a good thing.
Well, the end of this story is that I got a whole new me to deal with. The operation was on May 13th. My log says that about 3 o'clock on May 16th, I took my first walk. The male nurse, or whatever he was, said, well, what do you think? You want to take a walk? And I said, hell yes. I knew that was, you know, part of the ticket out of there. I was in the recovery room for quite an extended period of time due to all these blood test numbers, the potassium in the liver and all that foolishness. So I got to do a lot of laps. But that was part of the realization that I got a whole new second go at this. So I decided again, or reinforced my decision, that since I got a second shot, I wasn't going to blow it. So the recovery nurse said, you've got to walk 30 minutes a day. So I started walking around this table. 30 minutes a day around this table is not a great life-shattering event. But I quickly extended it to this table, to the dining room table, to the backyard around the swimming pool, and it took me about a week and a half to get out on the sidewalk. And I've been going ever since. My goal is to walk about 15 to 20 miles a week. I'm jogging for the first time since I was in my 50s. 3 months after the surgery, I jogged a mile just because. And 6 months, 6 months after, just because, I decided to jog 2 miles. And regularly now I jog somewhere between 4 and 6 miles a week. do a total of about 20 miles, 15 to 18 miles between the jogging and the walking. The doctor got a kick. I just fired the landscaper. I was in landscaping as a kid in 2 different venues, offered a 50% partnership in each landscaping business because of my ability to do good maintenance. And this guy was not doing good maintenance. So I'm now cutting my grass for the first time in 6 years. One of the signs that I was declining was that I couldn't keep up with my variable speed self-propelled lawnmower.
We went up to visit our daughter in Massachusetts last weekend, and the older of the 2 boys, the 11-year-old, gets out in the tree in the front yard. And he says, "Oh, Grandpa, I bet you can't do this." And that was all they needed to say to him, "I bet you can't." And there he was up in the tree, and then the younger grandson got there too, so we snapped a picture. I says, "I can't imagine when the last time you even considered climbing a tree."
Looking back, I marvel every day, and there's a whole bunch of firsts that are happening and have happened since the surgery. When I can now play my trombone literally better than I could for the last several years. I have more breath. I started taking an inhaler because my lung function was so poor, and now my phrases are into the whole notes, long and deep, and so is the volume at this point. So it's a whole new me.